Hey everybody, Anthony Selm here with the Modern Insurance Store and MedicareEasyStreet.com. Can anyone else agree with me that Medicare almost tries to make everything more confusing than it needs to be? Specifically, I'm talking about all these letters. We got A, B, C, D. We got the supplement plans, A, B, C, F, G, K, L, M, N, like it's the whole alphabet. And it really is more confusing than it needs to be. So today we're going to break this down, and we're going to first start with the 4 parts of Medicare, which are A, B, C, and D. Let's get started. So what I've pulled up here on my screen is the page 15 out of the government handbook, the Medicare and You handbook. This is the 2016 version, so depending on when you're watching this, it may be a different page. But this shows clearly what are the different parts of Medicare, and that's what we're going to go through. So we have Medicare Part A and B, Part C, otherwise known as Medicare Advantage, and Part D, which is Medicare prescription drug coverage. And we're going to kind of dive into Part A and B, what they cover, what they don't, the different supplement plans and how they can offset the cost there, and we will cover in more detail in another video Medicare Part C, which is Medicare Advantage, and how that compares to Medicare supplement coverage, and also how to get the best drug plan. So let's look at here Medicare Part A. You can see it's hospital coverage, pays for inpatient care in hospitals, skilled nursing facility, hospice care, and home health care. Part B, the medical insurance, covers services from doctors, so anything outside of a hospital, outpatient care, home health care, durable medical equipment, and preventative services. So what I've done is pulled up a benefit summary here from a Medicare supplement plan with a specific insurance carrier, and this will show us exactly what Medicare does and does not pay, and then how that supplement plan would pick up in its absence. So let's look at first the hospitalization part of Medicare Part A. It says here for the first 60 days, Medicare will pay all but $1,288. That's the Part A deductible. Then for days 61 through 90, Medicare pays all but $322 per day. And then for days 90 and beyond, all but $644 per day, which leaves quite a big responsibility for someone who only has Medicare without any supplement or something there to pick up the difference. And that's our job as an insurance agent, is to put a cap on those costs that Medicare would otherwise leave uncapped with only original Medicare A and B. Skilled nursing facility also has a copay there. After the first 20 days, it's $161 per day. Blood, Medicare pays for the first 3 pints. After that, you're on your own. Hospice care, Medicare's coverage is very good there. Only a small copay is required with still only original Medicare. For our Part B medical expenses, generally speaking, Medicare pays 80%. You're responsible for the 20% after you pay the deductible. The Part B deductible for this year is $166 at the time of this recording, and that's a once per year deductible. So once you've paid it, then generally speaking, Medicare will pick up 80% of the cost, leaving you with the other 20%. And again, that 20% doesn't have a cap. So again, our job as an insurance agent is to help someone get properly protected so that they're not going to end up with a $20,000, $30,000, $40,000, $50,000 medical bill. And that's really what I hear from you, from seniors all the time, are that we're retired, budget is tight, we don't want to be spending too much money, and we certainly don't want surprises when it comes to medical bills. So I hope this helps you understand the different parts of Medicare and what they do and don't pay. And again, we'll be addressing the Medicare Advantage and Part D drug plans in another video, as well as the 10 Medicare supplement plans and narrowing that down to a few that generally speaking are a good fit for most folks, and how to compare those and how to get the best rates for that. Hey, thanks for watching. If you liked what you saw or want to connect with us to learn more, you can find us on Facebook or subscribe to our YouTube channel, and we'd love to keep you up to date. Have a good day.